Symmetric, no deformities or lesions. If there's any obvious deformities, you're going to see it. Deviated septum or something like that. Somebody truly does have a deviated septum, you're going to say that. Deviated septum noted. Like you acknowledge it. You know, you don't want to just pretend it doesn't exist. It's there. Or there's a mass hanging off there or something like that. But otherwise, you're going to say, nose is symmetric, no deformities or skin lesions. You're going to look inside the nose real quick. Okay. You look inside, that mucous membrane is pink, no discharge, no lesions or polyps. And we already said no septal deviation. The septum is that center piece, that center thing. If your nose gets broke, it deviates one side to the other, and we don't have that. Nares are patent. This is a nair, your nostril. Can you do that? And the other side? Nares are patent bilaterally. So both sides, there's nothing going on. She's not draining, she's not on some kind of Claritin, and she's all stuffed up. If they were, you would note that, you know. And then we're going to go to the mouth. Again, you got to use your pen light. Do we have another?
Everybody stick together.
Should be. We'll get her another one.
I got it.
Good, good.
Oh, there you go.
Is it a numbered one? Perfect.
Thank you.
Thank you.
This the extra one too. Is this the extra one? You got one on you. Yep. Well,
Okay.
it's right here.
So we're on the second page. We're on the second page of your
Oh, that's mine. That's mine.
handouts, right? We're already at the mouth. You're almost done with day one. We're almost done, right? So let's move on. We did the nose. Let's go to the mouth. We're going to inspect the mouth, membranes, dental status, and lesions. So I'm going to look. Right? I'm going to look. You open your mouth, right? I'm going to look. I'm going to look into the mucous membranes. I'm looking at her teeth. Can you stick your tongue out? Straight? Okay. So you're going to say the tongue is straight and midline. Because if the tongue is deviated, what you don't want is the tongue off to the side, right? We want the tongue to come straight out. Again, we're talking about stroke or some kind of deficit, right? You're going to say mucosal and gingiva are pink. The gingiva is the gums. So if there would be, what you don't want to see is like white or super red. If they're bleeding, that would be bad. We don't want gingiva bleeding, nor do we want it white. That would be more like anemic. We would be concerned that there's some anemic or some, check their labs, make sure that they have their hemoglobin is where it needs to be, right? So the mucosa and gingiva are pink, no masses or lesions. We don't have any open sores. We don't have any white patches, right? We don't have thrush. That's a fungal infection in the mouth. You're checking for all that. Teeth are present, straight, and in good repair. Now, if they got teeth hanging out and falling out, they're not in good repair. Anything else other than the teeth are, if they're in pain or something like that, you have to address it. We already assessed the tongue is pink and slightly rough. No lesion, protrudes midline. Say those words. Just memorize this verbatim and you can't go wrong. Okay? Memorize the right-hand side. That's why we wrote it, to make it easier for you, right? Speech is clear, I already know. Her speech is clear, she spoke to me, she didn't have any problems with that. Speech is clear, no hoarseness. A lot of people miss that, I don't know why they miss that. But speech is clear with no hoarseness. Can you clench your teeth for me? No problems, client can clench teeth. We're moving on down to the neck. Again, what do we start with? What do we start with? Thank you. Yes, we start with inspection. I'm looking at her neck. This is the trachea. Trachea is midline. I don't see any bulges. I don't see any masses. I don't see at her carotid arteries. I don't see anything popping out, bulging, right? No bulges, pulsations bilaterally. Neck is centered midline, or the trachea is centered midline, okay? I want you to look, refer to your textbook. You guys got your textbook? I don't see any textbook. You get out your textbook? Thank you. We got somebody with a textbook.
Which one?
How about this? How about this? Just note the page. I hope it's on page 254, chapter 13. Talks about your cervical nodes. You're gonna have to palpate these nodes. Let me see.
Yeah, I made a copy of that for him.
Oh,
Oh yeah, I got
that's perfect.
The book
Where's
is-
that?
The book is a little better though.
She gave us in our notes yesterday.
In your notes yesterday. Whatever you got in your notes yesterday. Pull it out, or your book, either one. This is the page I want you to go to. If you're going to your paper, go to this page. If you're pulling out your book, go to page 254. All I want you to know is the cervical nose. So if you go back to your paper, it says here, page 260, it possibly could be page 254 or 260. And we're looking at the cervical node. It says, what you need to be saying is lymph nodes are soft and non-palpable. We don't want to feel lymph nodes, and if you do, they should be soft and not hard, okay?